Thanks to advances in cancer treatment and care over the past few decades, more people are surviving cancer, with more than 18 million cancer survivors in the U.S. today. Mary McCabe's pioneering work in the field of cancer survivorship has helped countless survivors find a way forward and navigate their needs and concerns as cancer survivors. Mary started her oncology nursing career at the Lombardi Comprehensive Cancer Center at Georgetown University. And from there, she took a position at the National Cancer Institute, where she focused on improving clinical trials and quality of life for the people participating in them. After 15 years at NCI, she moved on to Memorial Sloan-Kettering Cancer Center, where she was responsible for developing a center-wide program focused on the ongoing and long-term needs of cancer survivors.
The conventional model in the early 2000s for patients that survived a cancer that was diagnosed during their adult year is that they might be followed by their oncologists ad infinitum for a period of time that was never fully defined. And usually the exams were very quick exams. Our survivorship program that Mary helped develop really looked at the patients holistically and be able to provide that care all the way around and provide services. There was very little going on nationally and certainly within the institution to take care of long-term cancer survivors. And Mary had a very singular focus on improving that care.
The survivorship clinic that Mary helped develop at Memorial Sloan-Kettering used advanced practice providers on the front line and focused on the care survivors needed after their active treatment was over. It was so successful that it became a prototype for other cancer centers and practices across the country.
Well, it was the first place that I came upon that had any kind of resources to address, as I said, things like radiation fibrosis or secondary cancers or, psychological issues, and having, had the, ability to see what she did as both a patient and also working, on the newsletter as the patient editor from the beginning, of seeing all the programs that she developed and making survivorship as important as it was to Sloan-Kettering, as well as, her advocacy work and public policy. I mean, I think she covered all the bases of the survivorship initiative.
Mary worked tirelessly over the years in support of survivorship care plans that would summarize a cancer patient's treatment and lay out a plan for their medical care going forward.
She's been very involved at all different levels with the survivorship care plan. And there's no way primary care physicians can know about all of the issues of every long-term survivor who they see without having some kind of a good roadmap and good information so that they can, refer us to the right people. If the survivor gets the right kind of follow-up care, if they have the right kind of testing, if they have their physicians on alert to look for some of the potential long-term and late effects, then those get identified much more quickly and hopefully when something can be done about them.
Mary truly had a profound influence on the field of survivorship care during her long career. And now, even in retirement, Mary continues to contribute. She serves on the board of Children's Cancer Cause and is consulted for many cancer groups. She helped NCCS develop its Elevating Survivorship program and serves as a mentor and inspiration to advocates and healthcare professionals who are working to improve survivorship care in their local communities.
I'm just thrilled that she's receiving this award. She embodies what that award is about.
Mary was an absolute delight to work with. She was never down. She was never defeated. She always took any barrier as a challenge to be overcome.
I always think of Mary as really taking our stories, our survivor stories, and bringing validity to what we've been talking about.